Hey everybody, it's Dr. Eric Balkowitz. We're back for another edition of Thyroid Thursday, and today we're doing another Does This Person Need Thyroid Medication? This came from a discovery call this week where a person wanted to know what my opinion was on their thyroid values and whether my opinion would have been this is a person who needed to be on thyroid medication in the first place. So this is a person who went in for a health checkup. There were some other things going on with their health, and so they get a checkup. They're trying to optimize their health and their well-being. They see these labs, TSH at 4.08, free T4 at 1.2, free T3 at 3.2. This is my calculation. That wasn't on a lab report, but that's one of the calculations I use. So this person has been listening to podcasts and functional medicine practitioners and heard that TSH needs to be between 1.0 and 2.0. And so she said to her physician, do I have hypothyroidism and do I need a thyroid medication? And the MD, her medical physician, said you do not need thyroid medication. She went and saw a functional practitioner, and the functional medicine practitioner said, oh, you do need medication because TSH is outside the optimal range, and so recommended her starting thyroid hormone replacement therapy. The MD said, I don't think that's appropriate, that you don't need it, and she started thyroid hormone replacement therapy anyway with the functional medicine practitioner. And now it's been years and they've been trying to find this magical, mystical dose that puts all her lab values within an optimal range that's been set by somebody. And even though they've tried all kinds of different medications, T4s, T3s, separate T4s, separate T3s, combo medications, they can't get all those lab values into an optimal range. And when they get close to that optimal range, she does not feel well. And so she wants to know what my thought process is. Would I have recommended thyroid hormone replacement therapy? And I don't know the full history and the full story. I'm just looking at these labs. So these were the starter labs, and then she provided these labs as the follow-up labs a few years later. And TSH is 0.83, so that's actually below the optimal range. Free T4 is 0.63, that's below the lab range. Well, not below the lab range, but definitely below the optimal range. Free T3 is 2.8, that's considered below the optimal range. And the free T3 to free T4 is 0.49. So here at 0.32, the reference range, when we look at free T3 to free T4 ratio, it's usually 0.31 to 0.34. And this one, free T3 to free T4 ratio is 0.49. So this panel, when she thought she might have a thyroid condition, and her free T3 to free T4 ratio was fine. It was 0.32. She was doing a good job converting T4 to T3. The free values are in normal range. TSH is elevated. So why would TSH be elevated if she didn't have a thyroid glandular condition? Well, could she have been having a thyroid gland condition starting? Maybe, but we don't have totals, and it does appear that she's doing a pretty good job converting T4 to T3. And so would I have suggested that she be on thyroid medication? I don't prescribe, but it would not be my recommendation for this person to go on thyroid medication, because she obviously, at least looking at free T3 and free T4, does not appear to have a glandular condition going on where she can't produce enough T4 to get to the cells and be converted to T3. So even if she was tired, fatigued, and had other symptoms, we would still try and look at why she might have those signs and symptoms, but it likely is not caused by poor conversion of T4 to T3 at the cells and tissues, okay? Now, I would still look at the rest of a lab panel, look at the thyroid, or look at the lipids, I'd look at the blood glucose, look at renal function, look at all the other tissues to see if there's an indication of reduced thyroid physiology in those other systems. Is there inflammation in the system? And really try and get to the root cause. So that was then. Now, if we look at her labs, and she's on 65 milligrams of a natural thyroid T4 T3 combination, TSH is not optimal. It's low. free T4 in circulation is low. Free T3 in circulation is less than optimal, and the free T3 to free T4 ratio is elevated. This is a person who probably, because of the medication and maybe not addressing the underlying maybe inflammatory or issues that were going on before, this physician has likely triggered a glandular reduction in thyroid hormone production. So the thyroid hormone they're getting is suppressing TSH, and that is reducing the amount of T4 likely that is being generated by the thyroid gland. This medication is probably not overly helpful. And the reason the free T3 to free T4 ratio is elevated is probably a couple factors. One, they may have actually truly not have enough thyroid hormone in circulation. We don't have a total T4 and T3 to take a look at. We don't have a reverse T3 to look at, but free T3 is 0.63. So as fast as the cells are getting thyroid T4, they're probably converting it to T3. The other reason this free T3 to free T4 ratio may be where it's at, and the free T3 is high, is this person may have taken their medication right before they did the blood draw. And if you take T3 before the blood draw, for sure, it's going to raise the T3 levels. So moral of the story is this is a person who likely did not need thyroid medication, probably should have never been prescribed it to begin with. Does it mean that she didn't have some type of thyroid signaling issues at the cells and tissues, that she didn't have an inflammatory issue, didn't have other health issues going on? No, it doesn't mean that. But she did, at that point in time, she did not need thyroid medication. And the multiple year journey of trying to find some person's optimal range with drugs when you didn't really address the root issue is a complete failure, in my opinion. The MD was correct. This person should have never been put on thyroid medication, in my opinion. We have to keep in mind that TSH doesn't stay in a static range. TSH fluctuates based on what's going on in the body, based on when you ate, when you exercise, the stress that you're under, the time of year. There's lots of things that influence TSH. So we can't just look at a TSH and say, oh, because it's at 4 and it's not between this predetermined range of 1 to 2 that the person needs thyroid medication. That's ridiculous. What we have to do is look at that lab values in context with somebody's signs, their symptoms, the rest of their labs. And so when somebody sees this in functional medicine and says, oh, it's not in the optimal range, so I'm going to give a medication or a different hormone to try and force it into the range, they are not practicing functional medicine. They are practicing allopathic medicine. They're practicing manipulation of labs, thinking that if they manipulate a lab into value, that it's restored optimal health and function. And it just isn't true. And it winds up creating chaos in somebody's health and quality of life. And I feel bad for this person, but they should probably never have been on it. So this is where we have to do a better job as clinicians. We can't just read, we can't determine, hey, these are predetermined values, and we're going to, if something's outside that range, we're going to hammer it into range with a drug. What we do have to do with clinicians and labs is we have to interpret them, not just look for an H or an L on a lab report. We have to decide, is the lab value normal and appropriate for the patient? Is the lab value normal and inappropriate for a patient? Is the lab value abnormal and appropriate for the patient? Or is the lab value abnormal and inappropriate for the patient? And how do we do that? We have to look at their signs, their symptoms, their other labs, and make decisions like, hey, for this person, if they felt great and their TSH was 4.08, T4 is good, T3 is good, the ratio is good, and the rest of their labs look really pretty good, then there's probably nothing to do here. Maybe their set point for their TSH is a little bit higher. Maybe they have some genetic polymorphism that reduces the conversion of T4 to T3, so TSH stays a little bit higher to help out for that peripheral, for that polymorphism. Who knows? But just because it's out of a predetermined range that some talking head on a podcast or post says it has to be in this range doesn't mean it's true. If you have any questions, put them below wherever you watch the video. Thanks.